Is there a timer? Is there a timer that's going to show up? If not, can somebody give me a 1 minute warning?
Yep, we'll do.
So, good morning, y'all. Jen Dorsey, clinical director with Triple Track. Tobacco use is the number one cause of preventable death in the US. It kills more people every year than fentanyl and alcohol combined, every year. And of the 250,000 people just in Montgomery County, DC, and Northern Virginia who smoke or vape, 80% of them want to quit. 80%, but only 5% will succeed on their own, or what we call cold turkey. So my work at Triple Track is really in existence for the other 95% who can't stop cold turkey. You can go to the next slide. So embarrassingly, that's me around the age of 14. It's the only picture you're going to get. I'd already been smoking at that point for about 3 years, despite having asthma that I've had since I was born, resulted in multiple hospitalizations every year, my whole life. Um, I still smoked. My last hospitalization was in 2003, which is the same year I stopped smoking. But this didn't just impact me, obviously. People who love me the most cried and pleaded with me to stop. They tried throwing my cigarettes and lighters away, and a lot of yelling that I was stupid for slowly killing myself. But here's the thing, I wanted to quit and even decided to quit like countless times, pretty much every day, especially in the last few years of my smoking. But all anyone could really offer me were patches and gum. And the local hospital in Cleveland, where I was living at the time, had, I think, 5 classes that focused on teaching what I already knew. Smoking is bad for your health. We all already know that. I think our first graders or kindergartners already know that. And guess what, y'all? That is still what most people are offered today in 2021, almost, I mean, in 2025, almost 2026. What I didn't know and what most people still don't understand is that nicotine literally hijacks the nervous system. One of our patients with COPD said in group a few weeks ago, sometimes I'm more afraid of not smoking than I am of not breathing. Sometimes I'm more afraid of not smoking than I am of not breathing. It's a painful but really good example of how nicotine rewires the brain. It attaches to the parts of us that want comfort, relief, protection, and prioritizes that immediate relief and dismisses the executive functioning part of our brain that tells us this isn't good for our health and survival. Next slide. Um, and so the problem that Triple Track is really trying to solve is twofold. First, we're trying to change the entire culture and attitude towards nicotine as just a bad habit and raise awareness that it's a serious, complex, addictive disorder. Based on that, the other problem we hope to solve, specifically here across Maryland, DC, and Virginia, is to offer a program that uses the same levels of interventions that are applied to other addictive disorders like cocaine, opiates, alcohol. So that means our clients get both a therapist and psychiatrist in every single group and individual session, bringing together medicine, therapy, nervous system support, and community. And that lasts for a whole year. We also want to be accessible to as many people as we can. So our program is both virtual and we're in network with most insurance plans like Care First, Aetna, all those. Next slide. Almost every person I've met with in my one-to-ones has asked me the same question. Every single person. Is vaping actually harmful? And so this slide is for you all. Keeping in mind that we don't have the decades and decades of research that we do for tobacco, the bottom line is that vaping is not harmless, and it's really not a safe, long-term alternative to smoking. And so for anyone who's curious or wants to go deeper, this slide has links to some recent studies in the last, so in 2025, 2024, where you can see the results that we know of so far and how vaping impacts all parts of our physical system. Next slide. So trauma creates a gap between what someone needs emotionally and the soothing that they can access in the moment. For many people, nicotine fills that gap because it offers immediate relief. I'm talking 5 seconds when inhaled, 5 seconds. That's faster than when we use intravenous drugs. That takes about 13 seconds. So I want to share a story of someone who came to Triple Track through her PCP. She had been a smoker earlier in her life, but quit when she got married. Her husband hated the smell, and that was enough for her to stop at the time. Almost 4 years ago, she woke up and horribly found her husband dead in their bathroom. No warning, no time to process. Suddenly, she was alone with two young children, and her life obviously had really been shattered in that moment. She started smoking again that day. That was the relief she got that day. By the time she was referred to us last year, she was smoking about a pack a day, had tried to quit multiple times because she'd already been able to quit before. She works in the healthcare field, was constantly taking breaks during the day to smoke, and was starting to experience medical consequences that resulted in her taking time off work. She reluctantly, which is very common, started weekly individual and group therapy with Triple Track. For this client, medication turned down the noise of withdrawal and cravings so that she could focus on what was happening emotionally and psychologically inside of her. And once the fear of stopping was no longer the main focus, she was able to uncover what nicotine was doing for her. We all know what it does to us. She discovered what it was doing for her. And then she was able to shift to find other ways to take care of those parts of herself. So this wasn't about willpower. It wasn't about knowing better. Her smoking was about surviving trauma,
Mm.
parenting through grief, and really just trying to hold her life together. And she's now 9 months nicotine free, which is amazing and such a privilege to witness. And you can go to the next slide.
1 minute.
Thank you. Okay. People rarely come out and say, I need help quitting. So, some things to listen to are things like, I hate that I still do this. I don't smoke that much. I only smoke when I'm stressed. I quit and then I always start again, or I only vape. It's not that bad. So, when you hear any of these things, all you have to say is, I'd love to connect you with Jen Dorsey, a therapist who specializes in treating nicotine addiction. Can I give her your name and phone number? Next slide. So I have three specific requests for this chapter today. First, when you go to your dentist or your primary care doctor, would you be willing to bring brochures with you? This gives providers an option to refer to a program that has incredible results and offers more than just a few patches, and to thank Diamond for that suggestion. Second, I'd love to talk to folks who work in life insurance, because we know that a lot of people's premiums go up when they smoke. And if they can show that they've stopped for a year, they can reduce their costs. And finally, any HR professionals, employee wellness directors, or business owners who really want to care about their employees' health and productivity and want to reduce costs related to absenteeism and tobacco-related illnesses. And so here's my information, and really lovely to have this opportunity. And thank you very much.
Excellent
Thanks,
job.
Brian.
Excellent job. I've already written down life insurance. I know a lot of life insurance people. I think a lot of us do. Easy introductions. All right, very good.